Thank you so much, everyone, for joining. It's truly an honor, privilege. So many people are coming on board. I hadn't even imagined. I guess that's what the thrill of a live webinar is. Uh, Thank you. This is Unboxing AI. This is CARPL's attempt at spreading some of the knowledge, wisdom, and not so knowledgeable and wisdomy things that we learn as we embark on this journey of driving AI adoption across the world. Of course, one word about CARPL for those of you who are joining and don't know. I'm sure everybody would know, but still, we are an enterprise imaging AI platform. Now we have a category. When we started on this journey almost 5 years ago, and I'm guessing that's what we'll talk about, Vasant and I, a little bit. That was not a category, so now we are called Enterprise Imaging AI Platform or a AI Marketplace. We have been called an AI App Store, but in essence, we do nothing but take the world's leading, greatest, best AI solutions, clinical AI solutions, and put them into the world's top hospitals. And yes, if you are a radiology group, more than happy to help you embark on your AI journey. If you're a AI developer, more than happy to take you into these hospitals. And if you are just curious, more than happy to answer any and all questions that you have. The format of this webinar is going to be very informal. We will be across, and this is every week, 11 a.m. Eastern, 8:30 p.m. in India, and various time zones across the world. I don't know where all people are joining from. But yes, this is going to happen every week forever, as far as we can tell. So very exciting. It's a team commitment that we have made through the cause. So and as I said, there is a thrill of doing things live that we pondered over it quite a bit. Should we do a podcast? Should we do a webinar? Podcasts are recorded, longer webinars are shorter, but live you can ask questions, you can interact. So we decided to go for the harder one, which is a webinar. So hopefully this is time well spent for everyone here. These are also going to be put on YouTube immediately after. So in case you know people who might benefit, please feel free to send them the link. So without further ado, we decided to have the first webinar as an internal webinar. So I have with me Dr. Vasanth Venugopal. Vasant is currently in Sao Paulo for the JPR conference, where he's been leading a team of 5. We're showing off our integration with the Philips View Packs over there, doing some really cool stuff. Maybe we'll get to that as well. Uh, Now I have to introduce Vasant. So it's a very interesting thing. Officially, he is the Chief Medical Officer at CARPL. Unofficially, he is the first radiologist ever in the world who got replaced because of AI. Maybe not by AI, but because of AI, because he essentially gave up clinical medicine in this quest for doing AI, and then another radiologist replaced him. Apart from that, he is what I refer to as the domain layer or the clinical layer in CARPL. We're all making stuff, selling stuff, but then what it is that we make and what it is that we sell is governed by Vasant. And for the AI developers out there, he's the one who reaches out and gets you all excited about coming on to CARPL. Vasant, would you like to add to your introduction?
Oh, sure. Thanks, Vidur. I hope you can hear me well and loud.
Yes.
Good morning, good evening, good afternoon, good night, wherever you are from. So, as Vidur introduced, I'm a radiologist by training. I currently serve as the Chief Medical Officer for CARPL. To everyone on the panel, the questions that Vidur is going to ask, I'm not aware of it. It's completely unscripted. So, it's going to be direct, transparent enough answer from my side. I did my undergrad med school in southern part of the country, in Tanjore Medical College. I did my post graduation from Aligarh Muslim University. I did a cultural volte-face, moving from one part of the country to another, and then I moved to Delhi to do senior residency. I worked at Maulana Azad Medical College as assistant professor. then got disillusioned by whatever I had to, and then I moved on to India's one of the best radiology imaging providers out there, Mahajan Imaging. I worked there for close to 4 or 5 years before meeting with us serendipitously and embarking on this journey. We'll talk about more in detail later. So that's in a nutshell my life journey so far.
Great. So let's jump right into it. And again, everybody who's here, feel free to use the chat, use the questions, use whatever. We'll be trying to do this on the fly. So as we start, Vasant, and of course, since you are the first person to be on this webinar, you will not know this question, and subsequently everyone else will, if they do their homework. But I would like to know what is it that you do? What is your job? Uh, as if you were describing, your son who's almost, well, between the ages. But if you were describing what you do to a 5-year-old, how would you describe that?
Interesting. I've never thought of this in great detail, even though I'm familiar with the Feynman techniques. So let me try a stab at it. So I have two sons. One is 4 year and the other is 10 year. So let me try for the 4 year one first. So in fact, strangely, they think that I travel. The job I do is about going to different parts of the world and bringing them chocolates and cars, toy cars. So that's what they think. But I've never tried to explain them what I do. So if I have to put it very simple, like so I'm a radiologist, and then now I'm involved in the AI part of things. So I would try something like this, right? I'm part of a game, a dangerous game, where I have to solve puzzles every day, right? People come to me, a long list of people come to me with some problem in some part of the body, and they give me clues, right? The clues could be textual, could be pictures of them. They let me take some pictures of them, and then I have to put together the clues of the pictures and the text to figure out what is wrong with them, what is happening wrong with them. And I have to solve this really quick, otherwise they will get really sick and may even end up, really bad in hospitals or even die. So that's what I do as a radiologist. Now, every day I have to solve so many puzzles. I don't have enough time to do that. So I ended kind of delaying in solving the puzzle, or maybe making mistakes in solving the puzzle. So what I did was I kind of, you know, joined a team of smart engineers and built some computers in which I can feed those clues that I have and help me solve the puzzles faster, so that I can identify
So
the
you're
problem
you're
and
making
fix it.
you're making a puzzle solving machine.
Yes, correct. The
Not bad.
puzzle solving magical machine, right?
Puzzle solving magical machine that tells you what's wrong with you, why you have that
Correct.
tummy ache.
Yes, exactly.
Interesting.
So
That is actually pretty cool. No, but Vasant, on a serious note, right? You are somebody who a lot of the radiology community either looks up to or is confused to look up to look at. So how would can you just tell us a little bit of your journey? Like how did you get to doing what it is that you do today, which is building a platform for imaging AI? Like, what's the story there?
I'll be really very transparent and honest with this. It all started in a flash, I would say. I randomly landed up watching a YouTube video of Geoffrey Hinton. So everyone knows Geoffrey Hinton. We respect him a lot, and it was way back 2017, I think. It was a small clip. It's still there on the YouTube. Anyone can go and see. Wherein he was inside a hospital talking to radiologists, telling that the way deep learning. I didn't know what deep learning was when I was watching the video. You're saying that the way deep learning is progressing, the hospital should stop training radiologists 5 years from then. It was 2016, and and also he extended that talk to say that radiologists are like a coyote who has crossed the cliff and hadn't looked down. So it really threw me off balance. I didn't started taking notice. I think it's a fear of being redundant, or maybe the fear of getting replaced. Really, because that was a conversation that was happening around that period of time, 2016, 17. So I started taking notice, and then I got involved. I got myself involved into helping companies, working with them. Sure, which is a well-known company today globally, one of the leaders in the space. I was probably the first radiologist to work with them. They had a team of 12 engineers. Again, this was way back January 2018, I think. So I live in Delhi. I flew up to Mumbai to train them on radiology for 2 continuous days. That was a kind of, I would say, the moment it changed everything for me. And I started involving myself in the tech advancements in radiology. I was looking at 3D printing very actively, and I was looking at AI. That's when Vidur, you kind of returned back from the US. You also had your similar experiences, different in a different form with Zebra Medical, I think. And then we met serendipitously and started caring, which used to be a research organization in imaging neurosciences and genomics. At that point of time, we never had an idea to build any platform. The idea was to just help AI companies to figure out what is the right way to do stuff, help them with validations, help them with building algorithms, help them with regulatory studies. That's where we started. And while doing those validations, we realized that it's going to be a painful process for radiologists. It was tough for me. I was doing clinical work and involving in caring. So I got hold of a couple of early engineers we had, and we started building small tools that will help us to do the validation faster. And then after a period of time, we realized that we have built a complete tech stack, which is going to be the need of the entire world, which is going to use or looking at using AI in radiology. I think that's when we kind of pivoted and you know looking at the platform as the major focus and stop doing a lot of the other things that we are doing there. It's been an interesting journey so far.
So, so, so what you're saying is it all started as well, of course, I know the story, but yeah, but it all started uh, as a side interest,
It,
so to say,
yeah,
right? And
it
then
started as an
you got sucked
existential
into
threat.
yeah, existential threat, correct? Yes,
It started as an existential threat for me. Then
yeah.
I started involving slowly when I was checking the comfort level and if I am the right person to do it. It's like doing the person market fit. I'm the right person to do this. I'm doing justice to what I'm committing to. Then I realized that when I become confident that I'm one of the good people to do this, I then completely made the switch.
So tell me one thing, Vasant. We all know a lot of radiologists who are interested in the field of AI, especially nowadays, it's becoming more and more common, and I can maybe scroll the list and try to find a few or whatever. You know, uh, but you decided to talk more or think more on validation of AI as opposed to the building of AI. Right. And this is a constant debate that, we have with a lot of people out there where, there is this one thesis is that you build, like as a radiologist, there is nobody better suited to build AI, and hence you should be building them because you know the pain points and you have the data and the domain expertise. Whereas on the other side is, the approach that we subscribe to, which is, radiologist time is best suited, maybe testing AI. So what made you, lean towards the testing side of things in general?
Sure. So
And why not build,
explain that.
right? Why not make AI solutions?
Uh, I'll tell you about this. So, we talk to so many radiologists who want to get involved in the space, want to be part of our company, and be part of other companies. So basically, you can kind of divide that interest into three buckets, as I see it. One is people who are really passionate about radiology as a field, right? I love radiology, right? Any day, any field of medicine. In fact, during my preparation for the post graduation, I used to think that radiology is the only field I'm going to do. I'm in so much deep love with radiology. So you have to love radiology. That's the first thing. And then you have to be kind of passionate about the tech, the potentials about how tech can transform radiology, right? And then there are two other sets of people. We do talk, encounter them. People who are not very much into the med field. They wanted to be engineers, tech people, then landed up in medicine by accident. They want to do a career shift and then move to kind of the pure tech space of things and tech side of things, product side of the things. That's the second category of the people. And the third is people who are just kind of scouting the opportunity. Will it pay me more? Is it better? Will it give me a better lifestyle? Is it kind of giving more opportunity for growth? So everything is good, right? I'm not kind of judging any of these categories. Everything have their own priorities. For me personally, I was very passionate about radiology as a science and tech as an enabler of the science. And I did try out building, being part of building those solutions. I'll be honest with you, there are people who do this as a profession, right? Data scientists who know, and it's a very fast evolving field, right? If you want to be involved in that, you have to give up radiology. You can't be updated about what's happening in radiology. Radiology is also expanding. Data science is also expanding. The technology is expanding. So you can't be kind of, master of everything and taking all the riding all the horses at the same time. You have to choose one area, right? If you are passionate about radiology, you want to be updated about the radiology sciences. I think it's better to be on the validation side and be the gatekeeper of the technology. But if you are passionate, less passionate about radiology, more passionate about tech, and you want to be kind of updated about the tech advancements and use your radiology knowledge as a back end to build things, and you'll be better suited to be part of the the building piece of things. If you're someone looking at building a profile of money and career growth, you should be looking at the business side of things. How do you kind of bring these products to the hospitals, explain the value, build case studies around the outcomes, the economic ROIs, and do that. So everything is possible. You have to know what are you good at and what is your passion.
So why did
Simple.
you lean towards the validation and testing side of things?
So I loved radiology a lot more. So I wanted to make sure that I want to be the gatekeeper of the technology that's being kind of given to radiologists. In fact, Vidur, we have done this journey, right? We were talking a lot about validation to begin with. In fact, we were the first group, probably the only group not based in US who had the chance to be at the RSNA Fast Five and talk about the mirage of AI replacing radiologists way back in 2018. It was in our early days. And we talked about it a lot. And then there was a point of time in our journey, we realized we were thinking if a robust validation is a barrier to a kind of AI adoption, right? We discussed a lot. And I think of this in the context of a tech debt, right? If you're an engineer working in this field, or if you're an engineer, there's a thing called technology debt. There is a similar concept which I call as a validation debt, right? If you are a hospital who are looking at using AI clinically at scale, you have to do a reverse validation. There is no shortcut to it. There is no jugaad, the Hindi term to it. If you do a shortcut, you do a jugaad, you have to pay the debt back during your clinical deployment. We have seen this, right? We have tried doing shortcuts of validation, not including all the representative data sets, going live and then figuring out that the particular type of data set that's not included is constantly failing. And then we tried the concordance discordance approach, accepting the AI outputs as the ground truth and then going to live with that. There are challenges with that. And more importantly, there's a concept of doing toxic data sets, right? Even though a condition is very rare, if you don't include it as part of your validation set, you don't know that this rare condition is not going to be picked up by the AI algorithm. You won't make a boundary or limitations around your deployment, right? And also, I see validation as a continuous process. People call it as monitoring. It's literally a continuous validation post deployment, right? This has to be done. Even if you are reluctant to do it, you will be forced to do it. The governance is catching up. The regulatory body is catching up. Somebody has to take charge of the deployment. If you're not doing this continuous validation, monitoring, or even pre-deployment validation, somewhere along the line, you have to pay the debt with a lot of interest.
That is pretty interesting. So what you're actually saying is that if you don't do a good interview for an AI candidate, the candidate is probably going to be not very good.
Yes, definitely. You're
Let's
going to kind of face some difficulties with that candidate down the line. You have to be prepared for that.
Interesting. So there is this constant debate also about explainability and the importance of explainability of AI in from a validation perspective. right? Can you talk a little bit about the work that you have done, and it just maybe spark people's interest in, because I am personally very fond of that work because we did it.
Yeah.
But it would be interesting, I think, for the audience to know what explainability is, and then what is the difference between when a radiologist thinks of explainability and when a data scientist thinks of explainability.
Oh, sure, sure. Explainability is basically putting trust on the radiologist's mind about the AI solution, right? Typically, it's been abused, the black box term. That's why we coined the term unbox also. How do you unbox the black box? The deep learning techniques, the other newer techniques are all thought of as a black box techniques, which don't really robustly explain their outputs about their decisions, right? If there is a chest X-ray AI, and if you are processing a chest X-ray through it, and if it's calling that there is a consolidation pneumonia in this X-ray, if you don't, if it doesn't locate where the consolidation is, if it doesn't mark out it, and why does it make that call of consolidation, you're not going to trust it a lot. Consolidation is obviously so obvious. To go a much more complex algorithms about, the CT lung nodules or prostate cancer predictions, the pyrites categorizations, if there is not much, explanations in a understandable manner, the manner in which the radiologist can understand, if you don't put that explainability, it's not going to be trusted. The outputs are always going to be kind of looked at with suspicion. If you don't trust them, you're not going to leverage the full power of the AI solution.
So
So
what
that's
is
where,
what is the what is the least trusted AI algorithm that you have seen? So for everybody's knowledge, like CARPL has about 110 different AI solutions that we have on the platform. So without actually naming any, or any that you've seen in research, or any application, right? Like, so I'm thinking of
I,
this more from point of view of an algorithm that works, but we don't know why, or we don't know how, right?
I'll tell
I'm,
you,
I'm,
sorry, go ahead.
no, that's it. That's it.
So basically, there is, I hope you're going to land me in trouble. That's okay. So there is a new set of algorithms that are predicting unrelated things from a modality, right? To do a chest X-ray, you are expecting to predict or look for presence of conditions in the lung, maybe the ribs, probably the vertebra, or maybe the abdomen. Right now, there are solutions which can predict the osteoporotic DEXA score based on the chest X-ray image, right? Which is theoretically there is a connection because there is a bone density involved there, and then from the bone density you can predict DEXA. But if you think of it, the bone density that you see on an X-ray is very much dependent on several other factors about the penetration, the dosage of the X-ray dose, the contrast. There's so many confounding factors. I don't know how that will work. It has proven to work. There are robust validation studies that has done that. It's possible to predict osteoporosis risk based on chest X-ray, give a equivalent of a DEXA score. Solutions like that kind of move into the science fiction realm, and we need to bring in some form of I call it as understandability. We call it as understandability. But you know that explainability is more of a data science term, right? When people talk about explainability, the data science talk about explainability. They take a top-down approach. They will give you things which explain their algorithm functionings. It may not be in the language of a radiologist. It may not be in the language of a clinician. It may not be even in the language of a common user. So if you have to really build in trust in an AI application, you have to move from explainability to understandability. Right? One of our famous works that's available out there is a clinical explainability factor. We have to put the word clinical in front of explainability just to differentiate between what the data science approach explainability and how clinicians will approach explainability. So yeah, there
Interesting.
are
So what
several
you're saying is
some
basically
algorithms.
like those AI models that take one type of input and give a completely different type of output are extremely difficult to understand and explain simply because of the nature of the input and output. Very
Yes,
interesting. And
yes, yes.
my personal favorite are also sometimes these prediction algorithms that I can predict if you will get cancer 5 years from today. Like you will actually have to live out those 5 years to know
So no,
whether
correct.
the algorithm was right or not. Vasant, we have a question here, and
Okay.
since we only have about 5 minutes left, this is from Goranch. We've met him a couple of times. Goranch, for everyone, is a young physician who's now turned into a designer. It's a very interesting and amazing guy. So he says, can you share with us how challenging or intimidating it was for you to diverge from clinical medicine to the world of AI and tech? And what were the hurdles you encountered and how did you overcome them? I think that's a great question.
Yeah, it's a very great question. In fact, it was tough then than now, because I now see it's kind of there are more opportunities now, and it's kind of a stable. The ecosystem is stable as I see it. The hype is died down. There are more opportunities now than before. It was really challenging, but personally, I would say that I was fortunate enough to be kind of working for caring, because it was born out of Mahajan Imaging, which was a radiology group, and I was always having that safety net of falling down and going back to margin imaging. That kind of gave me some kind of comfort, I would say. Still, there is a lot of uncertainty around you being left out of the progress that's happening in the radiology field, radiology as a science, and getting out of touch with practice. Those are challenges, but once you decide with conviction, decide with passion, and you know that you are doing the best in this field, then it's easy to kind of go forward on that. The
Can
key
you go
hurdles,
specific into some hurdle? Exactly. That's what I was. I don't think I've
correct,
ever
correct.
even asked you that question. So
So the biggest hurdle is it's difficult for me to explain to people what I do. No, I tried explaining it to a 5-year-old using technique, but it's very difficult for you to explain what you do. That may not be a hurdle, I would say. The more kind of larger hurdle will be to understanding how tech and radiology are so similar and so different, right? Yeah, if I have to kind of give you specific example, the expectations around healthcare, right, as a professional, is that you are judged by the outcomes, number one, and your margin of error and failure is literally zero, right? Healthcare operates at n of zero. Even if you look at 100, 200 patients, even if one of the reads goes wrong, you will be kind of you have to face the brunt of the mistake that you do. When you move to a kind of a tech side, there is certain amounts of experiment you do during the initial phase, and you have to not be very kind of stringent about a particular facet of the product. You have to kind of expand your mindset and expand your horizon and be kind of looking at a broader impact from a tech, rather than being very narrow and very kind of a tighter kind of approach to the product. I don't know if I made sense to that statement, but
no, I think what you're saying essentially is that uh, you need to, like, as a
grow as a
radiologist,
person.
there is a
You have to
exactly
grow as
there's
a
a
person.
rather than doing a same very specific high implication task, you have to broaden your base to do many more tasks.
And
Very
also
interesting.
more
And
at the
can
personal
you talk a
level.
little about working with engineers
Yes,
and data
I'm coming
scientists?
there. So that's
Yeah.
a important kind of thing everyone need to be prepared. There's going to be a huge cultural shift. At least if you are a radiologist practiced in India, I did that, so I know how it works. And it's a completely different culture working in a healthcare system, hospitals, clinics, and then moving to a kind of a tech company with engineers of your age or even lesser. It's going to be a completely different kind of cultural shift you need to be prepared for, and you should be ready. I had some challenges, still I do have some challenges in adopting to that cultural shift, but that's how you grow as a person, right? You have
Yeah.
to be kind of become more mature than what you are. Other than that, from the field side, from the ecosystem side, at least as far as till this point, there's not much hurdle. If you are good at radiology, if you are good at understanding tech to a certain extent, you will flourish in this field without doubt.
So, no, I think lots of thoughts there for young physicians. We have another question from Prameer Kumar Reddy, but we'll take that. Maybe Praveen, we will post that on our LinkedIn group. Because we are almost at time. But just final thoughts, what would be your advice to, say, a young to be doctor, like a 18, 90-year-old med school student, or an 18, 90-year-old engineer who is looking to build a career in healthcare on the tech side, right? What would be your guidance and advice to someone like that?
The first thing is curiosity, right? You have to be very curious about what's happening around and open minded. The second kind of character you need to have is you need to get out of your comfort zone and have certain capabilities to take risks, right?
Mm.
If you're younger, you can take risks, you can afford to take risks, right? If you have, say, offer from a leading software company based out of Bay Area, would you choose that, or do you want to risk your career in working with a startup which is doing something in a domain which is not even mature enough? The product market fit is not figured out. So that kind of risk taking, character, if you have that, the reward would be quite lot. And especially in a field, even though radiology AI, we have talked about radiology AI is the leader in the healthcare AI. It's been 5, 6 years now. Still, it's very early days. Right?
Yeah.
The amount of solutions that we have doesn't even cover 4, 5% of the entire radiology workflow or workload that the radiologist does. So it's still very early days. If you have that tendency to take a little bit risk, if you're curious, if you're open-minded, you should immediately switch to this field and start exploring the options.
Nice. That is, I think, a great way to end today's first inaugural webinar. Thank you, Vasant. I think essentially what you're saying is jump into this field, create that impact, grow as a person, and while taking just a little bit of risk. Well, thank you so much to everyone for joining, and thank you to some of our friends. Terry, thank you so much for joining. You don't know what it means, and join our LinkedIn community. The idea here is very simple. We are just calling everyone we know, customers, partners, friends, team members, and the idea is to just spread everything that we know. So thank you so much, and next week, we'll see you at the same time, same virtual place. See you. Bye.
Thank you. Thank you, everyone. Bye bye.